Elsewhere, Health Cabinet Secretary Susan Nakhumicha has suspended NHIF branch managers whose areas of operation were affected by the insurance fraud scheme perpetrated by rogue private health facilities. Nakhumicha has also directed that the said rogue private hospitals be temporarily closed and inpatient admissions be transferred to allow for inspections pending further action. Well, this action by the Health Cabinet Secretary comes just a day after NTV aired a damning expose on how rogue private hospitals have been minting millions of shillings from the National Health Insurer. NTV's Sydney Chazima tells us more.
After the damning insurance fraud expose by NTV,
Good afternoon.
The government has moved to crack the whip on NHIF branch managers.
That all branch managers for NHIF in the affected areas be suspended immediately pending investigations.
The private hospitals that perpetrated the fraud have been ordered to transfer those admitted in the facilities within 24 hours to pave way for investigations.
Thereafter, our teams will enforce the directive for closure should they inspect and find them culpable, and they will remain closed until investigations are concluded.
Despite CS Nakhumicha's directives, the chairperson of Rural Private Hospitals Association Kenya, Brian Lishenga, wants the government to do more.
It's not the first time NHIF managers have been reshuffled or moved for fraud. What we are yet to see in Kenya, and as an association, what we want to see is actual arraignment in court and actual convictions, and for people to actually serve jail terms.
It is a general feeling that insiders at NHIF may have colluded with the rogue hospitals to enact the fraud. Nakhumicha is calling for a lifestyle audit of all NHIF staff.
This is to ensure that each member of staff can explain their wealth portfolio in consistency with their earnings. This will commence this month in conjunction with ESC, but will continue progressively to the end of the year.
Stakeholders in the private medical sector are calling on the government to review the special licenses issued to hospitals.
That model allows somebody or an investor, whoever it is, unscrupulous people, if not all of them are unscrupulous, but it gives the opening that you can come in, invest in a theater or two, invest in skeleton staff. You don't need to employ a lot of people, 3, 4, 5 nurses maximum. Sometimes even they are not qualified. And then you don't need to have a massive infrastructure. So once you have your theater here, your theater there, you will get approval.
The ministry has promised to conduct an audit of the payments and refund those defrauded. Sydney Chazima.